There are fewer than 40 known families on the entire planet carrying this disease. If one of your parents has it, you have a 50% chance of inheriting a single mutated gene that will eventually do something modern medicine still can't stop. It will take away your ability to sleep. Not for a night, not for a week, permanently. And it will kill you within about a year and a half of the moment your first symptom appears. The first recorded case traces back to an Italian doctor's family in the 1700s, a relative described as dying from a mysterious wasting illness that stole his sleep entirely before it killed him. Nobody understood what they were looking at for over 200 years, until a researcher in Bologna finally connected the dots in 1986, tracing the same illness through 5 generations of one aristocratic family. This is the story of that disease, month by month, from the day it wakes up inside you. Month 0. The mutation you've always had. You're 42 years old, and somewhere in chromosome 20, in a single gene called PRNP, you carry a mutation you were born with, inherited from a parent the same way you inherited your eye color. This gene's normal job is to produce a protein found throughout your brain, particularly in a small, walnut-sized structure deep inside called the thalamus, the brain's relay station for sleep, temperature, and dozens of other automatic functions you've never had to think about. For 42 years, that mutated gene has sat there, quietly producing a slightly different version of this protein, one prone to folding itself incorrectly. You've had no symptoms, no warning. Your life has looked completely ordinary, because this disease, for reasons researchers still don't fully understand, often waits decades before it activates, typically triggering sometime between your 20s and 70s, with the average onset landing around your late 40s. You knew this day might come. Your father died of the same thing at 51, after an illness doctors at the time couldn't fully explain, just called a rapid decline. You watched it happen as a teenager without understanding what you were watching. When genetic testing for this specific mutation became available years later, you had the choice of finding out in advance whether you carried it too. You chose not to test. Some people in families like yours want to know early. Others decide that knowing wouldn't change anything except how many years they'd spend waiting for it. Tonight, for the first time, something changes. You lie in bed, and your mind simply won't slow down. You assume it's stress. Month 1. The first sign. A few weeks in, the pattern is undeniable. You're falling asleep later, waking up earlier. When sleep does come, it's thin and fractured, full of dreams so vivid you sometimes can't tell, for a few groggy seconds, whether you're awake or not. You also notice something stranger. Sudden panic attacks, out of nowhere, alongside oddly specific phobias you've never had before, irrational fears that flare up and then fade. Your partner notices you flinching at things that never used to bother you, the sound of a door closing too hard, a particular shade of light through the blinds at dusk. Your doctor initially suspects anxiety or early onset insomnia, the ordinary kind millions of people deal with. He prescribes standard sleep aids. They don't work, not even slightly. Whatever's happening in your brain isn't responding to anything that helps a normal, sleepless night. Unknown to you, the misfolded prion protein inside your thalamus has begun doing what prion diseases do, recruiting normal copies of the protein nearby and twisting them into the same broken shape, like a chain reaction spreading outward, one misfolded protein at a time, slowly destroying the exact brain structure responsible for regulating your sleep. Month 4. The first stage ends. 4 months in, the panic attacks and strange phobias have become a near daily occurrence, and your sleep has dropped to a fraction of what it used to be. This marks the end of what doctors studying this disease call its first stage, roughly 4 months of progressively worsening insomnia tangled together with genuine psychiatric symptoms that look, on the surface, like a severe anxiety disorder. You finally see a neurologist, who orders an overnight sleep study. The results are bizarre. Your brain barely enters the deep, restorative stages of sleep at all anymore. Mostly, you cycle through light, fragmented dozing, occasionally slipping into brief dream states while seeming, to an outside observer, to still be partly awake. There's a clinical name for this strange, blended state. Doctors call it agrypnia excitata, a kind of waking dream, neither fully asleep nor fully conscious. Genetic testing follows. It comes back positive for the codon 178 mutation in the PRNP gene. Your neurologist delivers the diagnosis carefully: fatal familial insomnia. First documented by an Italian doctor in 1986, after he traced it through an aristocratic family that had been losing members to a mysterious, sleepless wasting illness for generations, long before anyone understood why. Your sister, who also chose not to test years ago, decides to get tested now, after watching what's happening to you. The waiting period between submitting the blood sample and getting her results back is, she tells you later, one of the longest 2 weeks of her life. Month 9, the second stage. By month 9, your body has started fighting itself in ways that have nothing to do with sleep directly. Your heart races constantly, even at rest. You sweat through your clothes for no reason. Your blood pressure climbs and won't come down. This is your autonomic nervous system unraveling, the part of your brain responsible for the automatic functions you never used to think about. Heart rate, temperature, blood pressure, all of it controlled by the same thalamic region the disease has been quietly destroying since month 1. Hallucinations begin too, vivid and sometimes terrifying, blurring further into the waking dream state your sleep study first identified. You sometimes hold full conversations with people who aren't there, lucid enough afterward to know it happened, unable to stop it from happening again. You become agitated for stretches at a time, then exhausted, then agitated again, a cycle that exhausts your family as much as it exhausts you. This second stage typically lasts around 5 months, and by the end of it, you and everyone around you understand that whatever this is, it's not slowing down. Month 12, total insomnia. 1 year in, you've reached a stage doctors simply call total insomnia. You don't sleep anymore. Not fragments, not naps, nothing. Your body has lost the ability entirely. The physical toll is visible to anyone who sees you. You've lost a significant amount of weight. Your skin and posture have aged dramatically in a matter of months, family members describing you as looking decades older than you did a year ago. Some patients in this stage develop incontinence. Speech becomes harder to control. This is the disease's third stage, lasting roughly 3 months, and it's the stage where the gap between this illness and ordinary insomnia becomes impossible to ignore. This isn't tiredness. This is a brain structure being systematically dismantled, one misfolded protein at a time. Your family has started keeping a journal of your lucid moments, the windows where you're clearly still yourself, still able to recognize them, still able to express what you need. Those windows are getting shorter and further apart, but they're not gone yet, and everyone around you holds on to them. Doctors have tried, in rare cases, using strong sedatives or even inducing medical comas to force rest. It almost never works. The thalamic damage by this point is too extensive. Forcing unconsciousness isn't the same as restoring the deep, structured sleep cycles your brain has lost the physical machinery to produce. Month 15, the final stage. By month 15, you've moved into what's typically the disease's last phase, deepening cognitive decline layered on top of the relentless sleeplessness. Memory and attention deteriorate. Some patients become unable to speak clearly. Many slip in and out of a stupor-like state, somewhere between sleep and coma, without ever reaching either one completely. Throughout all of this, something doctors find particularly unsettling about this disease is how intact deeper awareness can remain, even late into the illness. Patients have been documented retaining insight into their own condition well after losing the ability to communicate it. You are, in a very real sense, still in there for most of this. Your family talks to you anyway, every day, on the chance some part of you is still listening, even when you can no longer respond. The average total course of this disease, from the very first symptom to death, is around 18 months, though documented cases have ranged from as short as 7 months to as long as 6 years. There is currently no treatment that stops it, slows it meaningfully, or reverses any of the damage already done. Researchers have tested various approaches over the decades: immune therapies, experimental drugs aimed at stabilizing the prion protein before it misfolds, but nothing has yet changed the fundamental trajectory once symptoms begin. Supportive care, managing symptoms, keeping the patient comfortable, is the only tool medicine currently has. Month 18, the end. 18 months after a sleepless night you initially blamed on stress, your body finally stops. Not dramatically. Quietly, the way a system fails once every backup has already failed before it. Your sister, whose test results came back negative months ago, sits with you until the end anyway. The guilt of testing clean while watching you go through this is something she'll carry for a long time, separate from the grief itself. Researchers studying your case and the roughly 40 known families worldwide who carry mutations like yours have made one discovery that matters beyond your own diagnosis. This disease helped prove, for the first time in the early 1990s, that prions, the same kind of misfolded proteins responsible for diseases like Creutzfeldt-Jakob disease and mad cow disease, can also be inherited genetically, not just transmitted through contaminated tissue or food. Before this, prion diseases were thought of mainly as something you could only catch. Your disease, and the handful of families like yours, proved you could also simply be born with one, waiting silently for decades before it ever announces itself. Studying exactly how your version of this protein misfolds has become one of the clearest windows scientists have into how other prion diseases work as well. And somewhere right now, in one of those same handful of families, a person in their 20s or 30s is living a completely normal life, carrying the same mutation you did, sleeping just fine for now, with no idea whether their version of this disease will activate next year, in 20 years, or possibly never within their lifetime at all. They know the odds. 50% if their parent had it. They've decided to live anyway, the same way you did, for the 42 ordinary, sleepless free years that came before all of this.